right, I'm John. I'm the outpatient therapist in the evenings, and I also work in law enforcement, so I have a lot of experience with searching people and trying to find things. Um, so for a place like this, rather than law enforcement, there's some similarities, but there's a few differences as well. Um, so first things is you usually want to have two people searching. You want to have one person doing the actual search. You want to have another person standing off watching, if that's possible. That's the ideal scenario. Because what happens a lot of times is if you're the one doing the searching, the person that may be holding some kind of contraband or paraphernalia, whatever they have, they could be manipulating it with another part of their body or doing something else. So having a second person as just sort of like a safety person to watch and make sure that nothing like that is going on is a good first rule to have. A good second rule is if you have a female patient that you're going to be searching, have a female employee searching that person. If it's a male employee or if it's a male person being searched, have a male employee searching. You can have the opposite sex as the one watching or something like that, as long as it doesn't involve getting into where there might be something exposed. We don't want to do that to a patient. The next idea is when you go into a search, people don't like to be touched. So if you go up to somebody and just randomly put your hand on them, they're going to feel uncomfortable. And especially in a setting like this where they're already feeling vulnerable, they really don't want you to. And who knows what else they may be on. So you need to be able to talk to the people that you're going to be searching. So you're going to want to go up to them and you're going to want to tell them, hey, I have to search you. We're inside an inpatient facility. There's a lot of things you can't bring with you. Before I pat you down, do you have anything that's going to poke me, stick me, cut me, anything like that? And if you do, we have a table, we have something. Just go ahead and take it out of your pockets and put it here right now. You're not going to be in trouble for it. There's no judgments on it. You just can't have it while you're in here. Once they get through that, hopefully they unload whatever they have on them. But a lot of people will try to hide things on them still. So when it comes to the actual search, you're going to want to look at the person as 4 quadrants and a head. So you've got the head. A lot of people with longer hair, they can hide stuff in their hair. Some people wear hats. Obviously, we're going to take the hat off. We're going to go through it. When it comes to clothing and hats, anytime there's a seam, that's usually where people will try to hide things at. So like if you think of like a baseball cap, on the inside of a baseball cap, there's like a little ledge, like a sweatband, I guess. And on the inside of that, a lot of times is where people may hide some kind of contraband, whether it's drugs. Hopefully they're not trying to bring a razor or something like that in, but that's the type of things that you can find in there. When it comes to actually searching somebody then, so you want to start with the head, take the hat off, check the hair, remember to wear gloves, but grab the hair, go through the hair, whatever you have to do to make sure that they don't have something hidden in the hair. Most people aren't going to have something covering their neck. So then the next part you've got starting at the shoulders. And if you kind of look at my body, as I've got 4 appendages. I've got left arm, a right arm, left leg, and a right leg. So think of like splitting the body down the middle and then at the waist. And what we would have here is we'd have this quadrant, and then we've got the front and the back. And then like this is a quadrant, this is the front and the back, and it's all one quadrant. Same with the legs. What we would want to do then is we want to approach the person. We want to tell them, hey, you've unloaded everything from your pockets now. I'm going to approach you. I'm going to touch you to manipulate your clothing and try to search you. So you're going to walk up to them, and it's good to like maybe gently lay a hand on their arm beforehand so that they get used to the impact. Because again, a lot of people don't like to be touched, and they may flinch, they may act in an odd way. So you walk up to them, touch them on the arm, and I usually try to start at the wrist So if they have long sleeves, what you're going to want to do is you're going to want to go up the arm like this, and you're going to be manipulating the clothing as you work your hands up the arm. And then also on, say they have long sleeves, on the band of the wrist for the sleeves, there's a few extra seams. Sometimes people will have things sewn into that. That's probably for somebody more sophisticated that's like really trying to hide something, rather than somebody that just walked in off the street and is trying to hide something. But be aware of it, because that type of stuff does exist. So anyway, you want to start with the arm, work your way up the arm. You're going to be manipulating clothing kind of like this, and you're going to go across the front, and you're going to stay within that quadrant. So like how I just went down the middle, and then I'm kind of working over, and then I'm going to do the same thing on the back side. Then I'm going to move to this quadrant. I'm going to do the same thing. I'm going to manipulate the clothing, front and back. I'm going to check the collars. I'm going to go like this. For women, you have some extra hiding spaces with bras and things like that. Again, you want a woman doing the searching of the female party. So something the women employees can have the patient do. You can have them touch themselves like on the outside, grab their clothing, and lift their bra up while keeping their shirt covering everything. So they're going to lift their bra up, and then whatever would be in the bra can fall down. If they're not willing to do that, you can try to manipulate, and you can try to do that yourself if you think somebody would be hiding something there, because that is a common place for people to hide. Drugs, cell phones, anything you can imagine that they can fit in there, they can try to get something. So for women, yeah, you've got some extra stuff to pay attention to there. They may have something under the bra straps or anything, so make sure you're really getting good and thorough searches in and around those areas. So, all right, so then that brings us to the final two quadrants, and that's going to be the two legs. But what you need to watch out first is the belt line. So the belt line, there's a lot of places that are tighter to the body and will hold contraband close to the skin. So you need to sort of grab a belt or grab the waistline and like pull it out, shake it. Again, you're going to want to be gloved, but you can even reach inside the belt line and just sort of feel around, make sure there's nothing in there. So the belt line is a big deal. The belt line is also, people can hide things in their underwear very easily. So if somebody's walking in and they've got something that they want to hide, all they have to do really to hide it is they can just pull their pants out and drop it, and it's going to be stuck in their underwear somewhere. And that is going to be the most difficult thing to find. Assuming it's contraband that's like, maybe a small amount of narcotics in like a small baggie, that's going to be difficult to find. Now, if they were bringing in like a knife or something bigger, that's going to be more easily findable when you're actually patting them down. When it comes to like the plastic baggies, like they make noise, they crunch and they make different noises. So try to listen and try to watch. Sometimes you can see like bulges or baggy spots, like if they have something in their pockets. You probably can't see it from here, but I have a cell phone in my pocket, and I can see how the cell phone imprints on my clothing. And if I was searching somebody, I would be able to tell they have a cell phone in their pocket before I even get to them. But hopefully this person has already taken all their stuff out of their pockets and put it on the table and whatever. So anyway, so when you get to the pants, you're going to do the same thing. You're going to start at the ankle and you're going to move up. When you get to the area that nobody wants to touch, you're going to need to use like the back of your hand. Probably the best way to search somebody in those areas is to get behind them. And as you're going up the leg, if you're going up behind them, you can use your arm. And what you're going to do, so if you're behind them, if I'm behind a man and I go up his left leg, and then I go to search like his crotch area, if I pull my hand up like this, it's going to be in this V area right here, and the back of my hand will be to his genitalia, and that way I'm not inappropriately touching or even accused of inappropriately touching. This is also the area where having somebody watching you comes in handy, making sure, you know, nobody claims that you're fondling them or doing something inappropriate. So anyway, you're going to want to go up the we have a name for it. It's called the V. It's like this area right here. You're going to go up their left side with your right hand so that the back of your hand is to their genitalia. You're going to do the same thing on the left leg, and then you're going to use your left hand on the inside so that your left hand is coming up on this side of the V, okay? So then the only thing left now is like the ankles down. And you've got socks, which are a great hiding place. You've got shoes, which are also a great hiding place. It's usually a better policy to have them take their shoes and socks off, and you can look in the shoes, pull out the tongue, manipulate it however you can. Look at things as though somebody has purposely hidden something really well and you're trying to find it. And then the same thing with the socks. Take the sock, flip it inside out, take it back, just manipulate it, make sure there's nothing there. And at that point, you should be about done. Now, if they've brought in some kind of other bag or something like that, go through it as thoroughly as possible. There's a lot of interesting things on the market out there that you can buy at like flea markets, and you can order on Amazon, and it'll be like a toothbrush that pulls out and it's got like a hidden compartment in it. There's so many things out there like that. It would be difficult for me to try to sit here and name them, but anything that they bring from the outside, there's a chance that it's got some kind of hidden compartment in it. So if you're really looking for something, or if you really suspect that somebody's brought something in, you know, look at everything very thoroughly. And then something you might want to stress as you're talking to them is, hey, whatever narcotics you're bringing in or trying to bring in, keep in mind they react with other medications that the doctor might be prescribing. Somebody else might get a hold of it. There can be allergies. If it's street drugs, there can be fentanyl and other deadly things that are going to be in there. We're trying to keep everybody safe. And hopefully whoever we're dealing with will be compliant on that. But as everyone here knows, not everybody that comes in is happy once they get in here, and they can become violent. So, which is another reason why we should have two people working on it in case somebody does become violent in those moments. We've got somebody right there. Because as you're searching somebody, you're very close proximity, and it would be really easy for them to assault you if they're getting upset. So keep somebody else with you when you're doing a search. And I think that's all I've got.